What is Elevate Necklift? Well, this is a fantastic, innovative treatment that I've been performing for the last 5 years. In fact, I was one of the first UK surgeons to perform it. It involves treating patients in the submental area. So the submental area is the bit underneath the chin. I'm an example of somebody that can be treated with this treatment. No matter what you do, you don't have a nice refined jawline. You have what I call an obtuse angle of your neck so that it sits a lot more straighter. What we want to achieve is this, tucking the neck in. Commonly, and even in my career, I have inadvertently performed liposuction underneath the chin, thinking that this prominence is caused by fat, when actually there is a certain skeletal deformities that can occur. So for example, if your chin sits further back, this angle will become more obtuse. You can treat this sometimes with very invasive maxillofacial surgery, which can have ramifications in the future, for example, arthritis within this region. It can also not really be performed during adulthood and something that maybe you should address in childhood or adolescence. So it may be too invasive. If you liposuction this area and you remove the fat, sometimes the skin can be even looser afterwards, certainly after 2 to 3 years. So what's the answer? Well, you can perform soft surgery such as the Elevate Necklift. What this does is reposition the fat pad higher and also lift and tighten the muscle that sits over that fat. So you actually get a better, more refined jawline without disturbing any of the anatomical tissues. It's done in an extremely clever way. I inject anesthesia under local anesthetic underneath the whole of the neck region. Then we slowly tighten the muscle. So we pass a permanent stitch across this whole region and hold it almost like a basket so that when you bend down, your fat is repositioned higher. This is fantastic because a lot of patients want a more refined jawline, and if you don't have the skeletal structure to achieve that, you could waste a lot of treatments such as injecting large amounts of fillers to never be able to define a jawline, as well as some energy-based device treatments which will not work because it's the angle of your muscle and the angle at which the fat sits, that is the problem. So the Elevate Necklift is a semi-permanent treatment that addresses this. It's a niche treatment, niche surgery that's not performed in multiple centers in the UK. But for me, it's been highly successful even for younger patients that suffer from this, all the way through to the older patients as well. So sometimes I perform the Elevate Necklift with treatments such as the face tie. This is because the neck area is quite complicated. There's multiple layers in this region. There's a number of reasons why people may not have a nice defined neckline. It may be because of the skeletal structure, as mentioned earlier. The muscle is sitting a lot more obtuse, and that may need to be pinned back. That may be the only issue, and therefore Elevate's the only treatment that you need to do. You may have some accompanying fat and skin laxity, and this is where combining it with the face tight treatment will work really well. Face tight shrinks those fat cells without destroying them, but also shrinks the skin over the top. So if you think about it, if you combine both of them, you'll be tightening the muscle layer, tightening the fat layer, as well as tightening the skin. And that's the reason why you can get some great results combining it. When you do the Elevate Necklift, sometimes you even see results as soon as 2 weeks after the treatment, once the swelling is down, because especially if we're not combining it with other treatments such as face tie, you really don't have so much residual swelling. So all we're doing is repositioning that fat pad. It can feel a little bit tight within that region, but then that sensation tends to settle down when you speak to patients after a month after the procedure. So nearly immediate results can actually be obtained with this method. Results can actually be semi-permanent. So since I started doing this procedure in 2016, I've seen patients over 5 years with still sustained results. The suture is permanent and it moves that muscle back, and even that centimeter that we move the muscle back makes a vast difference across this whole area, so the support remains. In fact, it puts you at a higher pedestal for future aging, because if the muscle is pinned back and it's nice and tight and the fat has been repositioned, then you won't get as much skin laxity as you get older.